So this is a meeting for blood work follow-up between Mr. Murphy and the nurse practitioner. And the nurse practitioner explains that the reason they called Mr. Murphy back in was because they had gotten his test results and there were some levels that were abnormal, so they wanted to call him back in. And what was the issue? One of the issues was his cholesterol is about at double the limit that they would like to see. There are lipids, which are fats that are in the bloodstream, and there is good cholesterol and bad cholesterol. And actually his good cholesterol, which is the high density lipids, the HDL, is lower than they would like to see. And the HDL is what takes the cholesterol into the cells, so they'd like to see that number raised. And the low density lipids, which are the LDL cholesterol, that's the bad cholesterol, is too high, and that is what causes plaques to form in the arteries, and that causes a rough path for the blood to travel through the arteries and can lead to clots, which can then lead to a possible stroke or heart attack. And the nurse goes on to explain that there are some things that can be done that he could take control of, and other things that might be hereditary or genetic are more out of our control. So those are the things she wanted to discuss with him today. She also lets Mr. Murphy know that he has borderline high blood sugar, which, if not taken care of, could eventually lead to diabetes. The nurse mentions that she wants to make modifications conservatively first, and if medications are required, they can add that at a later date if they have to. First, she asked him to explain his typical diet, and she asked that he be truthful, what he typically eats for breakfast, lunch, and dinner in a typical week. And for breakfast, she asks if he eats that type of a breakfast every day out of the week. And then the nurse asks what he would eat on the other days. Okay, and the nurse asks what a typical lunch would be. And the nurse asks if he eats that every day for lunch. Okay, and the nurse asks if he's a coffee drinker. And she asks what he takes in his coffee. And she asks if that's whole milk. And it is whole milk that he adds to his coffee. And what would be a typical dinner, the nurse asked next. she asks if he eats vegetables with dinner, fruits or vegetables. Okay, and then she goes on to ask him what his typical snacking looks like. And the nurse asks if there are any other beverages that he typically drinks besides the coffee and Dr. Pepper. Okay, then the nurse moves on to ask about whether or not Mr. Murphy exercises. And the nurse asks if that would be about a quarter mile or how far that is that he goes around the block, as well as how many times a week he typically walks around the block with the dog. Okay, then the nurse asks about what he does for a living. And she asks if he moves around a lot at work or has a lot of activity at work. And how many hours does he typically work? The nurse asks next. Okay, and then the nurse asks about his tobacco use. And she asks how long he has been chewing tobacco. And how often he chews tobacco, whether it's about 2 or 3 times per day. And the nurse then explains that there seems to be a lot of improvement with Mr. Murphy's habits, and definitely some things that they can change in order to make some positive changes in his health. And she asks him about his motivation level to make those changes.